Hey there, colleagues. Thanks for joining me today. Today, I'm going to be talking about what I call is the medicine trap, and this is what early and mid-stage career physicians can fall into if they're not very careful. So let's get into it. In today's video, I'm going to show you one of the biggest traps that physicians fall into. Again, that I call the medicine trap. The medicine trap leads to burnout and poor quality of life. Once in this difficult trap, it's very difficult to get out of. And so I think it's one of the most important things that early stage physicians can really take mind of. If you're a mid-career physician, you're already in this trap and burnt out. I'll have other videos that give you guidance in terms of how to get out of that. So those of us who wanted to become physicians did so really because we had a passion towards helping others. We devoted ourselves to hard work and devoted our lives almost exclusively to medicine. We knew once we became physicians that, we'd probably do well financially. Many of us got into huge debt to do that, and we delayed gratification for years. However, the truth is, many physicians today, they're living paycheck to paycheck. They're strapped with debt. Greater than 50% of physicians describe themselves as being burnt out, and many physicians are thinking of leaving medicine as a career. Most physicians really have little to show for it at the end of their career, other than maybe a 401k, which, depending on how the market's doing, may not be that exciting. By the end of today's video, I want you to understand what the medicine trap is and how you can become aware of it so you don't fall into it. For those of you who are new to the channel, I'm Dr. Ron Wuest. I've spent 35 years as a psychiatrist helping patients, and many of them physicians, live better lives. And I'm dedicating this next chapter of my career to coaching new and mid-career physicians on how to avoid burnout, live their best lives, and create financial abundance. Because frankly, medical school never taught us to do that. So what is the medicine trap? We devoted ourselves to helping others. We're saddled, as I said, with debt from medical school. We delayed gratification. Finally, we became attending physicians. And this is kind of the signal to us that our hard work is paid off. We finally realized we could stop delaying gratification for the first time. And we got a little taste of the good life and what it feels like going from a very small income after medical school and residency and maybe fellowship to a larger income. Over time, we buy a new house, we have kids, lifestyle creep sets in, and we're getting a little taste of what it's like to enjoy our lives finally. This might be in our 30s. So you work a little harder to keep up with this lifestyle creep, and now you're in the medicine trap. Your life becomes consumed with working, and you start to get resentful of being a servant to your job, not being able to spend enough time with family, friends, not being able to really pursue other interests because medicine's so intensive in terms of having a short half-life and we have to keep up. And we find ourselves starting to live our lives in a way that is inconsistent with our core values. We have little time for ourselves. Many of us are working 50 to 80 hours a week, and we're missing out on life. We found ourselves now held hostage to the medicine trap. As a psychiatrist, I frequently was asked to work with physicians, and there are really two treatments. The first isn't really a treatment of physician burnout. It's helping physician resiliency. And certainly we can do that. And I've helped lots of physicians with resiliency and overcoming depression and things like that. But resiliency, lack of physician resiliency, is not the cause of burnout. The problem with burnout is that the core medical system and the systemic problems of organizations that really lead to these core problems that aren't able to be addressed. Medicine's changing quickly. Organizations have big priorities, and they can frankly put off and delay on some of the systemic issues causing frustration amongst physicians. Um, so, yes, I could help them with resiliency, but this wasn't dealing with the main problem. The main problem is they're spending way too much time working, so they didn't have enough time to nurture themselves and their families in the way that they really wanted to. In the next video, I'm going to show you 3 things that you could do that would set you on the right path to avoiding the medicine trap. I'll show you key things, steps you can take very early in your career, or if you're a mid-career physician, that you can start to contemplate that will help move you in a different direction. And the secret to enjoying your life is not depending only on your job to generate wealth, because then you're trapped into working more to essentially make more, and that becomes a vicious circle. So you need to work in a way that's in harmony with your life and not become a servant to your job. If you like this video, hit the subscribe button, share this with colleagues so I can continue to make content. Till next time, my goal is to help physicians in videos of less than 10 minutes per day. So it's not really a huge commitment. And I think it's something to do to start off your mornings. Until next time, I look forward to talking with you. Thank you. Bye-bye.